go ahead. Okay, today we're doing a tour of the respiratory models, and I'm going to start off here with a tour of the alveoli. This one does not have a key, so you're just going to have to go off of what I tell you. This video should be posted on the lab stuff page, so keep an eye out for it there. I'm going to start at the top. This is what is called a terminal bronchiole because this is the end, and the little pink things that you see around here are smooth muscle fibers, and that's what allows bronchoconstriction and bronchodilation for asthma, things like that. Okay, red vessels here. Anybody know what they are? Are they arteries or veins? How do you know? Is this pulmonary? What do we know about the colors of the pulmonary? Everything's reversed, right? So pulmonary vein is red, okay? Don't let that throw you off on the lab exam, okay? Pulmonary artery. Now remember, vein is always towards the heart, artery always away. It's not. It disregards the oxygen content. Remember, in the pulmonary system, it's reversed. Okay, alveoli are these entire clusters of these balls. The alveolar cavity is the space inside here, and I'm trying to think if there's anything else that you guys should know. On this side, this shows an individual alveolus, and the things that look like stars are called surfactant cells. They produce the surfactant, the liquid that keeps your lungs from collapsing and sticking to each other, okay? And I can't think of anything else that I want to tell you on this one. So let's go ahead and move on now to the larynx model. I'm going to show you the outside. There's a whole nother section here, but I'm going to show you this side and then the cross-sectional medial view. Okay, thyroid gland again, as we have said before. And then what we're going to do is I'm going to remove the thyroid and show you two named cartilages. This is called the thyroid cartilage for obvious reasons because the thyroid sits right on top of it. It's also what is known as your Adam's apple. So when you see that thing sticking out, that little bump, that's the top of the thyroid cartilage, okay? It tends to be more prominent in men than women. And sometimes when men transition to women, they get that shaved down. So the Adam's apple isn't as big. Okay, the next one, just below it here under this muscle, is called the cricoid cartilage. And you can see all of these in your text. Thyroid and cricoid cartilages. They represent the larynx. Everything below that, all the blue things here, are going to be cartilages of the trachea. Individual cartilages of the trachea. And what you'll notice on the back side is they're incomplete because that allows a bolus of food to take up part of the space in this space when you swallow because your esophagus is directly posterior to it. Now looking at the medial cross-sectional view, this is the trachea. This is what is called the vocal cord or vocal fold. Either one will be acceptable. The hole through here, so if I say name the hole right through here, that is called your glottis. The glottis is the opening to the top of the trachea. Now this little flap here is called the epiglottis, and the epiglottis is what folds down to cover the glottis, preventing food and beverage from getting down into your lungs when you swallow. Here on the outside, one thing I forgot to point out, this is the hyoid bone, and I don't think I asked that on the bone section, but I will be asking it on the respiratory. The hyoid bone is interesting because it is the only bone that's not attached to another bone. Every other bone touches another bone, and this one floats in these cartilages and muscles. Okay, hyoid bone. And that's it for this one. Moving over to the torso. Okay, as we saw before, this is the thyroid cartilage. Cricoid cartilage is kind of covered with muscle and other tissue. There's your thyroid gland. We went over the blood vessels. The trachea is here. Okay, taking a look at the branches of the airway leading down into lungs. Both of these that are the first branch of the trachea are called primary bronchi because they're the first, primary meaning first, the first branch of the airway. Everything after that are called secondary and tertiary bronchi, okay? Terminal bronchi is when we were down here. These are the only ones that can change cross-sectional area. All the ones here in the models that you can see don't change in cross-sectional area. They don't bronchodilate or constrict. Everything is held fully open. Now, to repeat, red in the lungs is what? Vein. Pulmonary vein, and blue, pulmonary artery. It's going to tend to throw you off unless you focus on that. Okay, the muscle that runs just above the liver and at the bottom of the lungs is your diaphragm. Okay, diaphragm. And anything else I want to say about this? Oh, the head. Let's go up into the head. There's our tongue again. And then we have the
Nasal concha.
concha, nasal concha. The lowest one is the inferior. The middle is the one above it. And superior, you can't see it very well, so don't worry about it. So middle and inferior nasal concha, their job is to warm and moisten incoming air so that it doesn't arrive at your lungs cold and dry. And anything else? There's the hyoid bone again. The nostrils are called nares, N-A-R-E-S. So the scientific name for your nostrils are your nares. And anything else here I want to show you? I think that's it. And then last is this lung model. It's pretty similar to what we've seen. There's our trachea, primary bronchi, secondary, tertiary bronchi, which are white and blue. Red is pulmonary vein, blue is pulmonary artery, and then you see it's green right here, some lymphatic tissue. Anything green in the lung model is lymphatic tissue. And I don't know if there's a key for this one, but I've more or less given you everything you need, and that's it.
All right.